I'm Dr. Richika, and today we are starting a module regarding infertility. So, coming to the basic, because everything is better if we start with basic. So, we will be today talking about infertility. What is infertility? The basics of infertility. So, now coming to it, that who all should see this video. So, this video is basically made for all the medical graduates or the practicing gynecologist or anybody who wants to practice gynecology, infertility associated with it, like the basic level 1 infertility, level 2, level 3 infertility, or people, normal couples, normal patients, or normal people who want to know about infertility and who want to learn about it. So all of them are welcome to see this module. So coming to it, that what is infertility? When do you say it is infertility? So infertility is basically of two types: primary and secondary. So in primary infertility means that patient has never conceived in her lifetime. Never conceived means she never had any abortion also, she has never conceived. Secondary infertility means a patient who has earlier conceived. Might be that conception has not led to a healthy pregnancy or even a delivery also. But if she has ever conceived and that conception is documented, mind it, documentation is very important, because the person will come to your OPD and will say that I have conceived, but they don't have any documentation. When you ask them, they will say that the periods were overdue for 15 days. So believe me, the periods can be overdue due to any reason. It is not necessary that she was pregnant so the period was overdue. So the documentation has to be very important. The beta HCG levels or a ultrasound report has to be very important to document that the patient is secondary infertile. So then coming to it, that now you know what are the two types of infertility. Now coming to it, that when do you say that the patient is infertile? When do you intervene? So for the infertility, it is very important that a person who has been staying with the husband and wife or a couple in a live-in relationship, maybe because maybe the patient has married just now, they are coming immediately after marriage, but they have been in a live-in relationship for say previous 11 months and they were not using any contraceptive mode. So in that case also the patient is infertile, because 12 months have lapsed without use of any contraceptives and the patient has not been able to conceive. That is what we call as primary infertility. But if the patient is more than 35 years of age, this comes down to 6 months. 6 months of unprotected intercourse, then you need to intervene and then you need to do the basic test of the couple. Same holds true for the secondary infertility also, because the patient has already conceived once, maybe the patient did not try, they were trying, now it has like 1 year has lapsed, so they have come to you. So basically then what you should intervene, you should always do the basic tests. So the tests can be divided into basic tests and then some are the advanced tests. So for the basic tests, first and foremost, you need to check the general well-being of both the partners. So for this, you need to do all the complete blood count, the urine routine, the urine culture, because you have to rule out any infection, because recurrent UTI also might be happening in the female. That might be a cause of a lot of discomfort. They might not be able to have sex properly because of that. The renal function test, the liver functional test, because there are medical disorders which also lead to this kind of delayed conception. There might be a change in, like she might be suffering from diabetes or impaired glucose tolerance. It's not necessary that she's having frank diabetes. So you need to get a glycosylated hemoglobin, the blood sugar test, the thyroid is very important for that. You need to get the thyroid test done, all the FT3, FT4, the free T3 and the free T4 is done. We don't do a total T3 and total T4. The free T3, T4 is more relevant. The TSH levels, the prolactin levels, plus obviously you need to have all the viral markers including the HIV, HBsAg, anti-HCV, VDRL for both the couples. You need to also have the specific test, targeted tests for the ovaries, for the uterus and the fallopian tubes. For the ovaries, you need to see the serum AMH, the anti-Mullerian hormone, plus you need to do a day 2 between day 2 to day 5 you need to do the general hormonal test of FSH, follicle stimulating hormone, luteinizing hormone, estradiol, progesterone levels, and you need to also see the antral follicle count. So if the AMH is low, that is not the only parameter of deciding that okay, the egg reserve is low. You need to make all these three things together, the hormonal studies, the AMH and the AFC, and then only you can come to a diagnosis that look, this female is having a low ovarian reserve. You need to check the fallopian tubes by doing either a hysterosalpingography or a sonosalpingography. But the hysterosalpingography is more accurate because it will give you the general outline of the uterus also. Plus you need to do a 3D, 4D detailed test, detailed analysis of the uterus. You can do the Doppler study of the endometrium area. Plus you should do the day 21 progesterone test, the high vaginal swab culture sensitivity, the endometrial biopsy test for the histopathology examination, and for the tuberculosis in the Southeast Asian region where tuberculosis is very rampant. These are some of the tests that need to be definitely done for a female partner. For the male partner, you should definitely go for the semen analysis test, and definitely don't forget to do the blood group and RH typing for both the couples, plus the HB electrophoresis test. These are very important because later on you will know, if you have skipped all this, then you will face problem when you are trying to make the couple conceive. We will be discussing every test one at a go, why it is responsible for fertility, why we should do it. So you should get all these tests done for the couple, including the semen analysis. And don't forget, whenever you tell the husband to get a semen analysis test, always tell them that how they have to ejaculate the sample, because they are not supposed to use condoms for that. Plus the abstinence period of 2 days minimum to 6 days maximum. Because 50% of the cases the male partner doesn't know, they give a wrong semen test and then they have a wrong report and everybody is so worried. For males also, you should always do, because nowadays the medical disorder is so much on the rise. So for the males also, the general fitness test is very much required, including diabetes and everything. Plus you should always take the clinical history of the patient. Clinical history means everything that has been taught from our basic MBBS days, from taking the age of the patient, the ethnicity of the patient, the occupational history of the patient, to like the menstrual history of the female. The age at menarche is also very important, because whether she was suffering any disorder during the time of menarche or during her teenage years, that is also very important. For the male partner, you should take the history regarding any history of any accident, any history of trauma, any history of blood transfusion, drug intake, allergy history, medical, surgical, family history, any history of fertility treatment in the past. These all need to be taken step by step. And believe me, you should not miss any of the steps. That is very important. That is the foremost thing. And history taking is an art, and you should not forget it. Whether you have become a super specialist or anything, you should take the history, because in the history only you will have hidden things. So these are the basic tests. In the basic investigation comes the history plus the diagnostic test. That is the blood diagnostic plus these X-ray and ultrasounds. So get all these done, then the reports will come, then only you should order for advanced test. So this is the basic class for infertility, how you have to start. And believe me, this is a basic what we say, but this is the main stone, this is the main pillar on which everything is based. So we will be discussing it further in our rest modules that will be taking up one by one. Thank you.